So I'm Dr. Shreya Shreera. So I am the president of Mission Brain India chapter, which is a small part of a bigger organization called Mission Brain. Now, Mission Brain is a non-profit organization which was founded by two great neurosurgeons called Dr. Alfredo Quinones and Dr. Michael Lawton. It was their vision to kind of serve the underserved population and make sure that neurosurgical care and medical services reach the most underserved parts of most developing countries. So we proudly present to you Mission Brain India chapter, which started off as a pioneering effort to be a branch of this amazing organization. Now, I also want to talk to you about Aveksha for Seva. It's an NGO we founded in India so that we could open up a smart clinic and we can serve Mission Brain's vision and mission statement by providing free OPD services and conducting medical camps to the most underserved parts of India, like rural Karnataka. So we started off as a pilot project there. Now we have so many activities going on in Aveksha for Seva and Mission Brain India chapter. To enlist a few, it's just educational activities like observership opportunities on a digital platform, and people can even come and volunteer here and take part. And also we provide free care and free medicines and free OPD services and free ECG and free EEG. So yeah, we started off in a small way. We want to create a difference. I really believe that success is measured by how many smiles we create. So through Aveksha and Mission Brain, we really want to serve this purpose. Thank you so much.
Hey there, welcome to TalentoDoc digital magazine for medical students. This is the USMLE series. TalentoDoc is a digital magazine revolving around the infinite world of medicine. From making concepts clear to helping somebody choose their dream career, it has anything and everything a medical student would need. Formed by a group of passionate young individuals, we aim to make this vast ocean of medical information more easily accessible and comprehensible. United States Medical Licensing Exam, or in short USMLE, is an exam through which any international medical graduate can enter the doors of America. Today's interview is about USMLE Step 3. It is indeed my pleasure to introduce our guest speaker and my dear friend Dr. Divya Ravi. She started off her medical journey by doing her MBBS from Srinivasa Institute of Medical Sciences, Mangalore, and then went on to become a casualty medical officer at NIMHANS, which is an apex neurotrauma center in South India. She then continued to become a junior resident at St. John's Medical College, Bangalore, which is yet another prestigious institute in the Department of Cardiology, and she successfully matched into the Unity Hospital, Rochester, New York in the fall of 2021 and is currently a first-year internal medicine resident at the same. It is truly an honor to have you, Dr. Divya. Apart from her academic flair, she is also a pianist, a vocalist, as well as a guitarist, and was a part of a very famous school band known as Adams. And she was also part of the school swimming team. On behalf of TalentoDoc, we welcome you to today's interview.
Thanks so much, Neha. Thank you.
Let's dive into this interview. To start off, Dr. Divya, can you please tell us about your medical journey so far?
Well, so first, after finishing about the 5.5 years of medical school at Srinivas, I decided to actually settle down and pick USMLE as the from residency in about halfway through internship, and then you start beginning the registration processes and plotting it out. The way I decided to do it was first go do my electives and then do CS, which was there at that point of time, but it's not there anymore. And then come back and do step 1 and step 2, which worked out pretty well because of the pandemic and everything that happened at that time. And I'd say the whole journey, given step 1 and step 2, and you had to give an extension. I had to extend my internship to do the electives as well. So it took about maybe 1.5 to 2 years in that time period. And alongside that, after maybe step 2CK, I was working while we were having interview sessions, which was when I worked in MHANS and St. John's, which was incredible. And both of them were quite amazing experiences. And then so the interview season finished at around February, and we got our the match results in March.
Okay.
And that was when we got to know if we matched, if we didn't. And if you did not match, then there would be a supplemental round as well. And that would also go on for a short period of time. It's about weeks long. Effectively, I think everything ends by about March end. So you'll know if you have matched or not in that season.
Yes.
And I know that this season's a little different because you have another supplemental addition to the application itself, where you get to signal the programs that you want to apply to. But that was not there when I was applying, but that's an addition that's there now. Right. Which means that if you have any particular program that you want to apply to, you can signal that and give any specifics of why you want to apply to that program, what your future goals are, and other questions regarding your residency that have to be answered and why you want to do it. Okay. And then I had actually I had planned to give my step 3 somewhere in the gap between February and when we start, but then because of the travel ban, couldn't exactly get to doing step 3 until I got here. And I gave step 3 in September, which was about first 3 months of internship. So yeah, and then that's it. You get the results in about 2 to 3 weeks. Mine came a little early, surprisingly, but yeah. That's about it.
How has staying in the US and starting off your residency been so far?
I think it's been pretty good so far. And given that everything's different and new for all international medical graduates, but especially in the setting of COVID, and every program is trying to cope with the challenges of COVID and having international medical graduates come in with all the travel bans that are going on. But all things considered, it's been really good so far. Come in summer, which is great. And it's been a very supportive program in terms of it's a very diverse program, a lot of people coming from different places, and you have the opportunities to learn from how different people with different experiences deal with the same cases, and you sort of pick up on that. And of course, there's still the emphasis on using the guidelines and everything, which just makes it easier for you to tackle all these things. And in such, it's been pretty good so far.
That's wonderful.
Busy, but nice.
Okay. Coming to the main content of this interview, which is USMLE Step 3, I would like to start off the first question. Could you please explain to the viewers what exactly is Step 3?
So Step 3 is the final exam in this huge, long steps process. You have to give it as an international medical graduate. You have to give it after you have become ECFMG certified, which means you have completed Step 1, Step 2, and your OETs, and then given all of that and got your ECFMG certification. And if you are a US medical graduate, then that would mean you're giving it some time during your residency. It involves some of your Step 1 topics as well as Step 2, and it's a little different in its questioning style as well as the pattern of the exam. It's a 2-day exam, and which is different from the others, which has been 8 and 9 hour exams, and very heavy on biostats and also management of cases as well, rather than just the pathology and pathogenesis of it. And it's something that you can give at mostly any time that you want in your residency or before you start if you're an IMG. Yeah, that's about it. Yeah.
What is the timeline when people give this exam, or when did you give this exam?
So for IMGs, you can give it anytime after you become ECFMG certified. And you can give, or you can give it at any time in your residency. It's preferable that you give it sometime close to when you give in your CK, not necessarily, but if you do, then it's just the topics that you've covered in CK is pretty fresh in your mind, and it's just a little easier to tackle step 3. And it also depends on what kind of visa that you want to go on. Essentially, if you want an H1 visa, especially if you have dependents coming with you, if you have a partner coming with you, then it's more ideal if you have an H1. And that would mean that you have to give your step 3 as well as get the results sometime before or along the time when you match, which is around March.
Okay.
So and if not, if you're going on a J1 visa, then you can give it sometime in the first year or maybe second year even, depending on your program specifics. But the closer that you give it to a step 2 CK will make it a little easier for you, just because you kind of still remember the test taking patterns that you set up for yourself. And a lot of the topics that you cover in CK is sort of carried forward. And you'll have to, if you're doing it during your internship period, it's important that you find the right time in terms of when you're doing your electives, or it's an easier rotation, so that you can schedule the exam on, it's 2 days. So you have to make sure that you put aside those 2 days, space out the 2 days if you can, so that the first day is about like 8 to 9 hour exam, and the second day is it's 9 hours, but you sorry, the first day is about 6 hours and the second day is about 9 hours, but you'll probably finish a little quicker because of the CCS cases. So it's nice if you give yourself a little interval between that. So all in all, if you can schedule it at the time when it's not too heavy a rotation for you, then that would be great. And also give yourself some time to prepare for it, and then and schedule it. You probably need about at least like 3 to 4 months to schedule the exam in prior, just because, I mean, it depends on the availability in which center you're going for, but I would suggest at least plan at least 4 months in prior to schedule the location at least.
What are the resources you use to crack this exam?
I would say do not overburden yourself with too many resources. Just UWorld and CCS cases for CCS. Now, the pattern of the exam is that, as you mentioned, it's 2 days. So the first day would be MCQs. The second day would be MCQs again. And then the second half of the portion would be 13 cases or simulations. So in this, it'll be ranging between 10 to 20 minute cases where you have to go through the histories and examine the patients. I mean, they'll give the examinations and the physicals, and you need to order the tests and go along and manage the cases essentially and treat them. So it's varying between 10 to 20 minutes, and usually you'll finish up a little quicker. The second day will take about it's 9 hours, but you can probably finish it up in maybe 6.5 to 7 hours, depending on your ease, of course. And the first day is all MCQs.
Okay.
So the first day is very biostats heavy. The second day will be very step 2 CK like, and the cases, of course. So for the cases, I used ccscases.com. There's a pack of about 140 cases that you can use, which tells you how you're doing, what else should you have ordered. There's also that little preventive bit, preventive care, I mean, which we tend to shortcut ourselves. So you get to see what else you could have done, and makes it easier for you to assess yourself. Whereas UWorld helps you with the MCQs and just the general software for the CCS cases as well.
What was your methodology in preparing for this exam?
So basically, because I was studying and working through it during internship and not a lot of time there, it's working on what your weak spots are. And for day one, it's very heavy on biostats.
Yes.
Work on biostats, finish all the questions that are in UWorld. There's also the biostats pack that is there, which you can go through if you want, and work on that. Make sure you're comfortable with doing drug ads and just being comfortable with biostats in general, because it's pretty heavy on that on day one. And there's also a little bit of first step one material. So maybe go through the first aid rapid review section for day one, along with the antimicrobials bit of it, and the mechanisms of actions and what you'd prefer for which type of bacterium and so on, choice of antibiotics or antifungals and so on. And then probably do one of the self-assessments, maybe about a week in prior or 2 weeks in prior, if you can, and see what your weak spots are and work on those, and and maybe if you can reassess yourself with the second assessment and go from there. Basically, it's very important that you get your weak points straightened out, and your biostats especially. It's super important that you get step one, because that's not something that you're consistently using during your internship or if you're working, unless you're working on a research job or so on. So, and even then, you're not necessarily always engaged in drug ads and things like that. So it's important that you keep yourself engaged and you understand that and you're comfortable with that. For day two, I just did all the high yield cases in CCS and figured out what was tough for me, and then went and redid it again. And just sort of became comfortable with the software, come up with a pro forma to go through in the order when you put in the orders and what you're looking for, and keep your differentials, because even though it seems like, oh, this is most definitely it, you still always have to keep your differentials. So be comfortable with the software.
Right. How much time do you need to prepare for this exam?
It depends again on when you want to schedule it and how much time you can give yourself, because a lot of the times when you are in your internship year, it depends on each program and what residency you're doing as well. If you're doing internal medicine residency, then a lot of the topics which you're doing is something that you're probably dealing with on a daily basis. Whereas if you've gone into the surgical side or pediatrics or any psychiatry, these are things that you don't necessarily, deal with a lot on a daily basis. So it may be a little difficult for you to do that in a short period of time. So if you are taking up those residencies, then maybe give yourself a little more time, just because you have to refresh all these topics in your mind. And if you're doing internal medicine, then it's probably a little easier because it's something that you're actively using, but still you need some time. I took about maybe 2 to 3 weeks of dedicated time. And just because I had a lot of floors in the time, so it was difficult to come back and study and things like that. But if you do have the time and the opportunity, I would say try to give it before you start residency, just because you're more fresh with your step 2 CK knowledge, and you can study for it easier, especially if you're not working at that time. Then you can give yourself that dedicated period, actually go through things comfortably at your own pace, and then gives step 3, and then you don't need to worry about it during your internship period, and you just get to relax and relatively relax. And yeah, so it depends. If you can, try and give it before you start residency, but if it's not, you don't need to sweat it, but give yourself, depending on how comfortable you are, with the CK knowledge somewhere at least maybe 2 to 3 weeks, and more if you're probably not so familiar with CK and it's been a while, or you just like to give yourself more time, then yeah.
Okay.
UWorld has about, I forgot, maybe like 1,600 questions.
Okay.
And so if you do want to go through all of that, then make sure that you pace yourself. And CCS cases in addition has about 140 cases, and UWorld has about 50 cases of its own. So all in all, if you want to get through all of this, then give yourself the time to not stress out. But otherwise, if you find yourself lacking time during your internship, then don't sweat it. You can schedule it during some elective or vacation period, depending on whatever works according to your schedule. And we'll focus on your weak topics, definitely biostats and antibiotics and antimicrobials.
Okay.
And I think you should be good.
What were the challenges you came across while preparing for this exam?
Scheduling. Oh, it is such a pain. So you have to find a center which works for you in the place that you stay at. If you are scheduling before you've started your residency, then you probably will be looking into whichever place is close by to where you're staying in the US. But there is probably a little more flexibility there. But give yourself, I mean, I had to schedule 6 months in prior. It depends on where you're staying. Of course, sometimes it's easier to schedule. It depends on where you are in the year. So usually around that March to June period is when everyone's trying to give their step 3. So it's a little tough to schedule during that period. A little later on during the year, it's easier just because everyone started their residency, so lesser likely to have those centers filled up. So maybe give that little bit of forethought and see when you'd want to give step 3 and schedule it. Remember that you can change the date up to 31 days before without having to pay. So just keep that in mind and schedule it. And the other things is just finding the time, essentially, once you've started your residency to prepare for it, and finding an elective that you're going to have to, or vacation period that you have to sacrifice. But just getting it over with essentially is important. So scheduling and finding the time is probably the hardest bit.
How was your experience during the day of the exam?
The day 1 is all MCQs. This is what you're used to for step 1 and step 2. And you come out of it feeling like you've tanked it. You feel terrible, and that's okay. And you feel like you've forgotten everything that you've ever done in 5.5 years plus extra, whatever, in medicine. And it's okay. You'll come out of that feeling that way. And more often than not, you will have done well. May find it difficult to assess how you've done, but it's okay. But it's a very exhaustive day. And it's all MCQs, but you'll finish in about 6 to 7 hours. And day 2 is a little different that way. It mixes things up. You do your MCQs again, and it's you feel more comfortable with this because it's more CK, less biostats, less step 1, which is a little more remote for most of us. And then it has CCS cases, and especially if you've already started your residency, then it's something that you're kind of used to, like putting those orders in and managing cases in general. This is what you do. And it's a little more interactive, more fun that way. So it's less exhaustive at the second day, but and it's just something that's new, CCS cases in general, and it gets over much quicker than you expect it to. And they say it's about 10 to 20 minutes, but I'm sure most of the cases actually got over much quicker than that.
Okay.
So all in all, you finish a little earlier, which is great. You walk out and you still don't know how you've done, and it's perfectly okay. It's done, and that's what's important.
Yes. And as you suggested, spacing the 2 days would be advisable for any medical student.
Yes, I mean, just because after the first day you're pretty exhausted, and you're used to, at least in step 1 and step 2, just having that 1 day over with, and that's it. But for this, you have another day to follow up with. So give yourself maybe 1 to 2 days at the very least. I gave myself 3 just because I could, but depending on how your schedule is, but try and not have it back to back just because it's hard to keep yourself engaged for 2 days, and give yourself a break in between. And that's when you can actually brush up on your CCS cases as well and make yourself feel more comfortable. So I would suggest spacing it.
Wonderful. How was your results day experience?
I actually didn't even realize the results were out.
Okay.
And I was expecting it to be out in like 3 weeks. I came a little earlier and just saw it in my mailbox. And it's nerve-wracking, like all the results for the other steps. But the thing about step 3 is it's more essential for us, at least just for your visa purpose. And along with that, for fellowships, they actually probably would prefer to see your step 1 and step 2 performance,
right,
and just see that your step 3 is going alongside how you've done in step 1 and step 2 for an improvement, which just means that you're getting better. And apart from that, I think for fellowships, they really just focus more on your letters of recommendation and how you've actually done during residency. Right. And also, you do have your boards at the end of your residency, which is the final exam of your residency. But as far as that, this is just a culmination of all your steps. You're finishing that up, and the results themselves, it's just important to try and give it your best shot. Make sure that you pass, because that's definitely going to show up on your portfolio, and try and keep it alongside of how you've done step 1 and step 2. Yeah, and that's about it. But don't stress about it as much as the other steps, for sure, because this is something that is just, you've probably become used to the patterns of step 1 and step 2 by that time, and it does get better. And the results will probably play into what you want to do for fellowship afterwards as well. But for most bits, even the most competitive fellowships will also be looking more at your step 1 and step 2 scores than step 3. And then they just want to see that you're keeping up that consistency in your performance more than anything else. And apart from that, don't stress it too much, but get it over with. So yeah.
And Divya, this is the pass or fail, or is it a score-based exam?
It's a score-based exam. You do get a score, much like your step 1. And step 2, but now I guess step 1 is becoming pass-fail. So like your step 2, you do get a score. The curve is a little different from the previous score. So it's a little more difficult to perform on this just because everything's so mixed up. So don't be too hard on yourself. Try your best. And remember that your performance as a resident during your residency counts the most. So make sure that you do not have to put a stop to any of your duties when you're working, and or if it's during your interview season, then make sure that you are not curtailing your interviews in any way to try and accommodate this. So just that scheduling essentially is very important, that you plan that out and just get it over with.
Yes. Okay, thank you. Coming to the next question, what next for a USMLE graduate or a resident after step 3?
So after step 3, there's the rest of your residency to finish. So depending on when you're taking it, if it's in your intern year, if it's in your second year of residency, or some even in the third year of residency, depending on your programs, may take it at that time. So it's important, I think, to try and get your step 3 done with before you get too close to your fellowship applications, just because that's something that the programs look for, that you've completed your step 3 and you have your score ready. So it's nice to get that out of the way. After you finish your step 3, it's basically focusing on your residency, keeping up with all your electives and rotations, and trying to figure out what you want to do next. If you, depending on what residency you're in and what options you want to pursue after residency. So it's making a choice about that and trying to do, and if you're closing in towards the end of your residency, closing in towards the end of your residency, then you focus on your boards and do well in that. And if you do decide to have a fellowship, to apply for fellowships afterwards, then you have to focus on that.
Okay.
And yeah, that's it. What comes up after step 3.
Okay, thank you. That was a crisp insight. I think the USMLE journey itself is a long haul, almost like a marathon. And this is the last mile of step 3 would be the last mile of the marathon. But of course, the residency program itself or any other higher education is another race which people start off with. But truly, how does it feel to finish and complete the entire USMLE exams and be done with it and actually be a resident walking through the corridors of a great hospital, which is the Unity Hospital, Rochester in New York? How does it feel? Is it an exciting experience, or how is a day in your life right now?
So you will probably feel like, oh, I've finished everything there is when you finish step 3, but no, there's the rest of your residency. You still have to wake up at 5:30 or 4 the next day morning and get to your rounds and see your patients and do all of that stuff and be a resident in general. So, but it does feel good to have that out of the way. You're at least done with that, so you can focus on all the other things that you want to do for your residency in your period of prep and stuff. So it feels nice. It feels great to get that out of the way. And residency itself is its own long drawn battle. And but I think it's really an experience for everyone in so many different ways. There's no two similar experiences for anybody, and I think that's amazing. And there's a lot of new things that you have to deal with and adapt to, and that is challenging but exciting in its own way. And I think that's what we're all working towards, is just trying to challenge ourselves and make it more interesting for ourselves, and that's what it is. And it's very important that you when you keep challenging yourself and you're growing as a person, just to make sure that you're also enjoying yourself. So keep that in mind and try to make things work, I guess. That's what it is. Yeah.
To conclude this interview, I would like to ask my final question. I'm sure many people watching this video right now have just thought of maybe taking USMLE as an option, or have just finished any of your exams like the step 1, step 2, or already applying for interviews. What would your advice be, Dr. Divya, as a resident right now in the United States, to them?
That just keep at it. It's going to get better, and pace yourself. It's a long drawn journey, but it'll be worth it at the end of the day, because it's your effort that you're putting into, and irrespective of what the results are and where you go and how this journey turns out, you're still trying to make better yourself and challenge yourself, which is the most important thing at the end of the day. So you're going to have a great time afterwards, no matter how your scores are and whatever comes out of this. So I think that's important, and that's the whole point with this. So yeah, just keep at it. Don't lose hope. Keep heart and all of that stuff. So yeah.
Thank you so much, Dr. Divya, for taking your time off your busy schedule as a resident in New York right now. And we're doing this interview across the globe. So I'm in India, Bangalore, and Dr. Divya is in New York, US. And it's such a pleasure that you could help out the thousands of medical students watching this, who I'm sure will get inspired and ignite their flames inside them and pursue their journey in the US. as well as other medical students who would, I'm sure, find their path and home to their calling. Thank you once again. It means a lot, and your words will truly inspire every single viewer out there into achieving their goals and reaching greater heights.
Thanks, Neha. Thank you.